Hello again, Northeast Ohio, and thanks so much for joining us on just another beautiful fall afternoon. They just keep coming one after another. Big fan of that. And a very happy Victory Monday.
Yes.
So all the Browns fans out there, thanks so much for choosing What's New with Betsy Kling. I'm Jay Crawford.
You can feel the humidity in the air.
Yeah,
that
you
is
definitely could feel that.
Big key to what's coming in the forecast.
That's a foretelling?
Matt has a lot of information to give you about heavy rain potential that's coming Tuesday night into Wednesday.
Okay.
Definitely something you're going to want to pay attention to.
All right, we'll look forward to that. We start at 5 with some news on the coronavirus. We have some relief for parents today, some much anticipated relief. It's not here yet, but it's around the corner. Pfizer says that its vaccine is safe for kids between the ages of 5 and 11 years old.
Now, we know a lot of parents have questions about this. Me too. So we brought in our senior health correspondent, Monica Robbins. Obviously, Monica, top of mind for parents. We've been waiting and waiting and waiting for the green light for the 5 to 12-year-olds. Is that coming soon?
Soon, relatively, yes, you could say that. Now, Pfizer says its vaccine is safe for kids, but we are still a ways off from this becoming available. Pfizer now has to submit emergency use authorization to the FDA by the end of this month, and then the FDA has to go over all of their data before deciding whether or not to sign off on this one for kids. Now, the earliest that may happen is the end of October. The timing is important because cases in kids have jumped 240% since July. Here's what we know about the vaccine impact on kids.
The vaccine in the 5 to 11-year-olds from Pfizer has shown to be very effective in initiating a very protective antibody response, even at smaller doses, because we're not giving the adult dose to these smaller children. We're giving about a third of that, and yet we're seeing a very, very good antibody response.
Now, there is something different about this. Dr. Esper says the robust antibody response didn't show up until a month after the second dose, but that response was able to neutralize the virus. This trial involved 2,000 kids. Moderna and Johnson & Johnson are also testing their vaccines in younger kids, 5 to 11, but likely they are a few months behind Pfizer, and of course, Pfizer hoping to have results of 6 months to 2 years by the end of this year.
Wow.
That is big news. I mean, we know that the coronavirus, it's very rare that it kills young kids, but these are potential spreaders. If they get it, then they can give it to people who are more vulnerable. So this hopefully will help slow some of that spread.
Yeah, I mean, there's still a lot of question about that too, how much viral load the kids get and how much they can impact people. But what we do know is that the Delta variant is impacting kids far more. So it's really important that, nobody wants to have that kid that gets the Delta variant and ends up in the hospital.
Well, my question is regarding, and this is not just for kids, it's for adults too. We've got flu shots. It's now pneumonia shot season and shingles shots, and then the kids have other vaccine shots. How do you layer all this stuff together?
Talk to your doctor.
Obviously.
That's the first thing I would tell you. When it comes to kids, though, what people need to understand is that the CDC does say you can get your flu shot and COVID vaccine at the same time.
Okay, that's a big one.
That is a big one, yes. You can do that. Now, as for the other vaccines, you really need to talk to your doctor or pediatrician about those. But what's really important to remember is it depends how tough the person is.
Yeah.
Because you're going to have two sore arms if you get them both at the same time. If you're a tough cookie and you don't mind that, or you're a masochist like me, go ahead. And,
or you just want to get it all over with at once.
Or you just want to get it all over with at once. Yeah, absolutely. Go ahead and get them both. But yeah, otherwise, it is safe to do so. It's going to be personal preference. But again, as for the others, it's really important you talk to your doctor.
Okay.
All right, we'll keep an eye on it.
Sure.
Thanks, Monica.